All right, do you know what time it is?
It's time to do our Kegels.
It is, and this is the most, in some ways, my favorite part of the show. Because who doesn't want a strong pelvic floor, Twila?
I think I want one, so I'm good.
Exactly. So this is the time of the show when we do our Kegel exercises. It's so easy. It's so simple and can be so effective and life-changing.
That's right.
And so we are going to go over the customized GynoCast world-renowned regimen.
Okay, you ready?
Yep.
3
times a day.
6
days a week.
9
seconds per Kegel exercise.
and 12.
Kegels in a row to make a rep. It's so simple. All you have to do is do 12 in a row, 3 times a day, 6 days a week, and hold them for 9 seconds. You will have a pelvic floor like a chain link fence. You will be able to pull a trailer with it. You will be the envy of your neighbors.
I think you will be, that's for sure.
Hello, everyone, and welcome back to the GynoCast. My name is Dr. Eric Heegaard, board-certified obstetrician gynecologist. I'm here with my wing woman, my boss, my buddy, Twila Dang.
Hello.
How are you?
I'm good. How are you?
I'm great. And today we're going to talk about something that is near and dear to my heart.
Okay.
And that is hormonal contraception. But even beyond that, Twila, I can see your eyes rolling back. Like,
No, I was
birth control. You're beyond that, right? You don't care about it anymore.
No, I totally still care about it. It's just funny that you said it was near and dear to your heart.
It is.
Okay.
And to my uterus.
Okay, Sister Soldier. I'm glad it's near and dear to your uterus.
I think it's wandered away.
You're wandering.
Wandered out of my body.
Your wandering womb.
Well, so why is it near and dear to my heart? Well,
okay.
As you know, and I talk about this on the GynoCast quite a bit, a huge amount of my practice is based on treating women with pelvic pain and endometriosis and many other things.
Yes.
And one of the most important things that we use are hormonal contraception.
Okay.
And the other thing that's important to me to talk about this is that it's been in the news quite a bit as something that is a little bit under attack in terms of coverage and that sort of thing in legislation. I can understand the complexity. I'm not trying to trivialize people's strong feelings about what should be covered and what shouldn't be covered. I know that some people have religious beliefs that are strongly against the coverage of this sort of thing. But the point I want to make is that if you can get beyond that, you can also see that we use these medications for things other than contraception. And that's what I want to talk about today, because these medications, whether you want to talk about birth control pills or injectable hormonal contraception like injectable progesterones, the ring, the patch, that sort of thing, we use for things other than contraception. And it is incredibly important that we have access to these medications. And even if you don't want to use it for birth control, women should have access to these medications to treat other important conditions that they may be struggling with.
Right. So it's just sort of to be clear, birth control isn't just used for preventing pregnancy oftentimes.
Right, exactly. And sometimes when we're talking to parents, for example, a young woman will come in with a girl, an adolescent will come in with her parents.
Yeah.
And we start saying, well, maybe we should try putting her on a birth control pill. You can see the parents start kind of gasping. And
panic, yeah.
And
well, I have teenagers, and I have a teenage girl. I know that feeling
right.
of, oh, hey.
Right, it makes people uncomfortable and leads to sometimes uncomfortable conversations or conversations that perhaps you weren't ready to have quite yet.
Yeah, but we're probably overdue to have anyway.
Right. And so it's important to, and maybe we as practitioners should come up with another way of discussing these pills using things like or hormonal management pills.
Well, I told you we recorded a previous episode where I mentioned that I feel like the magic bullet that's missing in this conversation around birth control is that it's used for other purposes. So why hasn't a company just rebranded the product?
Like Prozac did for premenstrual syndrome.
Yeah.
They had a completely different name for it, but it was Prozac.
Yeah. I mean, I think because the term birth control has become such a loaded term that anytime you mention it outside of that usage, or really anytime you mention it at all, people get up in arms about it. They get nervous.
That's right.
Or they get, upset, or it immediately sort of triggers their own sort of wellspring and of belief system, and
Right.
then they either approach it as like a positive or a negative. There seems to be really no middle on that.
Right. And so I kind of was hoping that we could change the conversation a little bit, and so we could talk about some of the other benefits that are really necessary for a large number of women. And the data is a little mucky. I will just say this. When you're trying to figure out, like...
That sounds like a real medical term, mucky.
Mucky, it is. And when we're trying to figure out, well, what percentage of women use the birth control pill or hormonal contraceptive only for contraception? Well, it's a little hard to tease out because they use it for so many other things. It's probably on the order of, let's just say, 15%, 20%.
Well, how come that's such a difficult sort of set of numbers to get? Because it seems like it would just be a pretty clear, like you ask the users and they fall under certain categories, and if they overlap, we just track the overlap.
Well, I don't know the answer to that, actually, but I've seen the data, and nobody seems to be terribly confident about it. And I think probably because it's data that's comes from questionnaires, and people are not terribly honest with questionnaires.
Fair point. And do you think that data skewed at all by sort of the ways in which people obtain birth control? Like, I mean, I know when I was in college, I did not get my birth control because I went to my doctor or my family's doctor. I went to the free clinic, and the free clinic had it available, and it was on a sliding scale. So if I needed it for free, I could get it, and if I had money to pay, I paid it. And so.
Well, I don't know the answer to that. That's a good question, but I think that we can all agree on this: is that women use hormonal contraception for more than one thing.
Yes.
Virtually,
yes.
A lot of them. Let's just say agree on, not everybody, but a lot of them do.
Yeah.
And so, and some of the conditions they use them for are not just kind of trivial things. There are things that can affect their health, their quality of life, their ability to be productive in their relationships and work and society.
Mm-hmm.
And as such, in my opinion, they should be covered. They should be covered. Now, just hang on with me.
I'm with you.
I'm just saying that, wherever you are on the spectrum of the conversation on this, I think at minimum, insurance companies and people who offer benefits should say, well, we don't, let's just say on one side of the argument, we don't offer hormonal contraception or we don't cover contraception, but there should be some allowance for some exception if you're using it for other means.
See, and again, I think that's why it needs to be rebranded, because if it was rebranded, then we would know these are used for contraceptive purposes. And then the same drug repackaged over here in the nice blue pill form or purple pill form, or, that's called, happiness for when you're, when you're PMSing or something like that, or, for many of the medical conditions that you've talked about here on the GynoCast that is used in a way to help prevent pain. It winds up working as a form of pain management because it keeps certain things from happening to your body that creates pain responses.
Right.
If we had something like that over here, it would make it very clear cut for insurance industries and for companies that have certain views to say, okay, I'm not using it, you're not using it for this purpose, or it's not being given for this purpose, then it's allowable and we cover it and it's fine because it's for pain or for suffering or for whatever it is, as opposed to it's just super black and white, cut and dry over here. If it says birth control, the answer is no.
Right. Well, I agree with you, and I will let you be the spearhead in terms of trying to talk to the medical industrial complex and
sounds good
pharmaceutical industry.
Well, everybody knows they listen to me. So.
That's true. So here's some data that I think at least you can at least refer to.
Okay.
About there's been some data to show that at least over 50% of women use hormonal contraceptive for things other than birth control. About 30% of it use it for cramps and menstrual pain. 28 to 30% use it for period regulation, menstrual regulation. 14 to 15% use it for acne. 4%, I think, which is very low, use it for endometriosis, et cetera. I think that's low. Mm-hmm. But so I want to talk about some of these things that we use it for.
Okay.
And so probably the most important thing that I think as a general gynecologist that we use in terms of treating women almost all the time, again, beyond contraception, is we use it to help regulate periods. And there are a lot of reasons why people have irregular periods. The most common being probably is polycystic ovarian syndrome, which we've done a show on. Mm-hmm. And I would like to refer people to listen to that fabulous show that we did on this very common hormonal condition. But it is important for women to have regular periods. for their health. And if you're not having regular periods, we need to figure out why, and we need to manage them. And one of the reasons, or one of the ways that we can do this for many women is to put them on a birth control pill or a patch or a ring or something like that. Mm-hmm. And the reason it works is that birth control pills or hormonal contraception have estrogen and progesterone in them. And so they take over the work that the ovary normally does in terms of stimulating the lining of the uterus, shedding the lining off, and it works incredibly well. And they are safe, they're effective, and generally they're fairly affordable. And so I would say that I bet you if I see 30 patients in a day, I'm going to be refilling or starting somebody on a hormonal contraception pill or patch or ring. I bet you a third of the patients, at least, if not more. And a lot of those, again, for reasons other than contraception. And so why is it important to have a regular period? Well, we've talked about this on the GynoCast before, but the lining of the uterus is sort of like a lawn. Or as I keep trying to refine this imagery. I've moved it to sod.
No, stop doing that.
Why?
Because the first time that you described this, I thought you did it very well, very simple, very direct, and it allowed for people to understand it in very plain-spoken English. You're trying to refine it as if we don't get that plain-spokenness, but we totally do. You don't have to make it clearer.
What's the difference between grass and sod? I like sod because, let's go with grass. Anyway, you got to have a healthy lawn, what do you got to do to Twila?
Water it.
And, oh my God.
Feed it.
No, fertilize it.
Oh, okay.
No, you got to water it and you got to cut it.
Right.
And so, you can understand the uterus and abnormal bleeding almost all the time with this kind of metaphor. The lining of the uterus is like grass or like sod. Estrogen's like water. It makes the lining thick.
Right. Makes it grow.
It makes it grow.
Okay.
Progesterone is like a lawnmower. Thins it out.
Right. Cuts it down.
And under normal circumstances, when a woman's not on a birth control pill or hormonal contraception, you have this yin-yang balance between the stimulative effect of estrogen and the suppressive, cutting, thinning effect of progesterone.
Right.
And many things can cause that balance to get abnormal. Polycystic ovarian syndrome, which is an estrogen-dominant state where women don't release progesterone, thyroid disease, other hormonal abnormalities. And so in that situation, if you have a hormonal condition where there's too much estrogen or that lining of the uterus is being exposed to excessive estrogen over long amounts of time, it can actually lead to precancer. Not just discomfort and it can lead to heavy bleeding as well, but it can actually cause precancer and cancer. And so what we do is we put them on pills because that gives you the balance of estrogen and progesterone the way it's supposed to be and can get a woman to have a regular period, to thin out her lining, and to avoid development of polyps or precancer or cancer. That's simple.
It is simple.
Don't you just love it?
I do.
Let's end the show right now. Isn't that enough?
I like that analogy when it's very simple, without the sod.
Okay, so, okay.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
So, and so beyond just, menstrual irregularities or abnormal bleeding, heavy bleeding does the same thing. Some people can have regular periods but have very heavy bleeding. Birth control pills, hormonal contraception can significantly improve that over time. And again, is one of the many ways that we use to control this. Painful periods, again, it can be incredibly effective for that. And so, it is really probably the first thing that we have in our armamentarium to manage these conditions.
Okay, point of order. You just said armamentarium.
Is that all right?
No, I'm just saying you might need to define that because even I, in my $15 word vocabulary, have not heard that one in a while.
Well, now I'm starting to question my vocabulary. Look it up.
Why am I going to look it up? I'm trying to help the audience out here. I love it when you use the big words, especially when they're big words that aren't medical words, but you don't.
Well, it's supposed to be military. I'm talking about
Armamentarium.
we got to. I think. Oh my goodness! Now I want to grab. Where's my phone? I want to look it up.
I don't know.
I think of armamentarium meaning the weapons that you have to attack, to hopefully be in
well
defense.
stated.
Yeah.
See, there you go. Well stated.
Well, now I'm wondering whether I need to look it up. Maybe I'm going to
No.
sound like a total idiot if it's
No,
completely
you know,
wrong.
I'll put it in the syllabus. I'm just,
It's probably another word for a
making it-
fern or some sort of house plant.
It sounded really good and very large vocabulary of
Very
you.
large vocabulary. I was word slinging there, Twila.
I don't mind.
Word
I don't mind a couple of word slinging moments. I just try to make sure I keep up with them because sometimes the audience wants to know these things.
Okay, so I'm going to add a little bit of trivia here that I heard in the last week that I've been chuckling about.
Oh no!
And so I'm gonna, at the end of the show, I'm going to, if you don't know the answer to this, I will tell you.
Okay.
What is the lingam? The lingam.
I don't know. I thought you were going to say.
If you know the answer to that,
you're not getting any
you're not-
prizes, so don't try.
I've been
You
cracking up.
get individual cool points in your head where you're listening to this podcast because you'll say, "I know something that they don't know right now."
And I hope I'm not if I'm saying it the right. But so, what is the lingam and what is the yoni?
Isn't a yoni an egg?
Maybe not. Maybe.
I mean,
not.
I
don't
know. The last time I heard the phrase yoni, it was the eggs that you insert so that you can help your pelvic floor.
Oh,
They're
you
called
might be
yoni
close.
eggs.
Yeah, so you might be close. So at the end of the show, we're going to define these things. 'Cause I have been. I
okay.
got to tell you,
All right.
I love these different terms, and it's been cracking me up all week. I've been telling everybody I know, asking them this. So we have heavy menstrual bleeding, painful bleeding, and just other heavy periods, menstrual irregularities we talk about, and so contraceptive pills, etc. We use for that. Now, many people don't know this. Did you know that birth control pills can decrease your risk of ovarian cancer and uterine cancer by 50%?
By 50%?
Did I just say that? 50%.
Yeah,
50%.
you did.
That's a lot.
Really significant.
Yeah.
Then why don't we hear that more?
I don't know. But it's true.
And why don't we
Tout it
why don't-
more?
well, yeah, because it would seem like if that is something that runs in your family, or as much as we talk about
Precisely.
those particular types of cancer, that you would think that would be more of a media thread that we talk about,
Yep.
even if there were side effects or something. You would think that would be a very significant part of a media thread when we're talking about those particular types of cancer.
That's right. Well, it is, if you've seen stories about women like Christina Applegate or Angelina Jolie who have hereditary breast ovarian cancer syndrome, one of the things that we can use, if you are determined to be at elevated risk of ovarian cancer, one of the things we suggest is to put people on birth control pills. And, it's cheap, it's effective. If in a situation where a woman is not ready to have her ovaries removed, if she's at that increased risk, one of the things we can do is put them on a birth control pill.
Oh.
So cancer reduction, both in the ovaries and the uterus. Boom.
Well, yeah.
Okay, you have acne? You don't have acne. Your skin is gorgeous.
Thank
Did
you,
you ever
dear.
did you ever have acne as a child?
No, I just had teenage acne.
Yeah. I had a little bit of that too. But some people have a lot of acne, and what are some of the things we use to manage acne, Twila Dang? What will the dermatologist oftentimes recommend? What would it be?
Birth control.
How did you come up with that? That's amazing.
I'm a
Birth
genius.
control pills. It's amazing. And why does that happen? Well, birth control pills decrease free testosterone. Testosterone is what stimulates those little glands in your skin, and that's why teenagers get pimples all over the place. They've got, their testosterone is raging.
Yeah, the hormones out of control.
Hormones out of control, and so we use these to manage that.
Oh, and I will say this. I've heard of that. I've heard of that not necessarily for teenagers, but I've definitely heard of that for adults, particularly women of my age range that are hitting the fun perimenopause and menopause situations, where all of a sudden we get a new, sort of relationship with acne that we didn't have for a while.
A new relationship with acne. I love it. Yeah, precisely. And so it is just another thing that we use birth control pills for. And, if you're sitting there making legislation and making decisions and you don't have painful periods, let's just imagine a group of humans who don't have menstrual irregularities, who don't have painful periods, who don't necessarily, let's just say, get pregnant.
So you say a group of humans, you mean men?
Well, it wasn't. That's a little politically incorrect to.
Oh,
to be
okay. But I mean, they don't have
gender-specific,
periods and they don't get pregnant.
Right.
They don't have uteruses.
Exactly.
Just thinking.
Yeah. So
sometimes
okay,
you call
said
a duck a duck.
If it walks like a duck and quacks like a duck, and
Is a duck.
it's a duck. Exactly. And so, should those people be I'm just saying. I could be wrong. Should they be legislating for other humans that have?
Okay, I won't. Okay, I'll be careful on
periods?
that. I won't say that they shouldn't be legislating. I would say that one, it would be nice if there was more equal representation in making this type of legislation. I would also say that it would be lovely to have those who are in the position to create this legislation seeking out the voices of people that use this medication, people who are familiar with this medication in terms of they prescribe it or they create it or they develop it, and not have it solely be in the hands of policymakers who may have other motivations to say no to things.
That's right.
As opposed to sort of looking at the entire spectrum of how it could be used and why it's being used.
Yes.
They tend to be able to indulge in a very sort of narrow view of, I feel about this personally because of my upbringing, my religious background, my makeup, my experience with it, which may be very, very minimal on a lot of sides. So, yeah.
Do you know about 10% of women have very heavy bleeding, menstrual bleeding?
Wow.
And some of those women will actually bleed so heavily that it can cause them to have anemia, which means not enough blood in their bodies to actually allow them to function comfortably. Mm-hmm. And birth control pills, again, is one of the first weapons that we have in our holsters.
Oh, boy. We're going to get a bunch of these weapons references, aren't we? Okay.
That allows that birth control pills decrease the amount of bleeding.
Okay.
And and we talked about cramping. How about premenstrual syndrome? You have that?
Yep.
You have that, Twila? You're right now? Is that why you're so agitated?
No, it's just because it's Friday. No, it's really and truly. I do know. That wasn't something I normally or naturally had. That has been a nice little, yet another
benefit of
perimenopause. Is all of a sudden I have a very short fuse the week before my period.
Yeah. And you know what's happening is that the well-oiled machine of your ovaries, the delicate dance, the ballet of estrogen, progesterone, testosterone, is not as smoothly coordinated as it used to be.
You phrase that really well. I just usually phrase it as my body's decided I'm done. I'm done with you. I'm done with your nonsense. We're not having any more kids. Deal with it.
Yeah.
And
all right.
I'm trying to deal with it.
Well, you seem to be doing very well. But birth control pills can be helpful during that time to stabilize hormones. Mm-hmm. How about menstrual migraines? Are any of those white dudes making policy? Do they have what? Oh, I can't believe I just said that.
What? You said white dudes. I didn't say it. I'm just saying.
Do they have menstrual migraines? I don't think so.
No.
But we use that birth control pills to help with that. Now, if you've ever had a menstrual migraine, I'm sounding like I've had one, but I've only ever
had one, and it actually came in a couple months after I gave birth to my second child. So I think it was even sort of more of a stress induced migraine, because my body was shifting, sort of trying to get back to normal, and I wasn't sleeping on a regular pattern. I had 2 little kids under 18 months old, and I have so much sympathy for women who go through that on a regular basis. Yeah. It struck like a lightning bolt. It felt like somebody stabbed me in the eye, and I couldn't function. I went from like sitting and talking to my husband 1 minute, and then 17 hours later I was like waking up in a bed like I don't even really know how I got here. So they're terrifying.
It's terrible. Mm-hmm. It's terrible. And then I'm gonna just touch on this again because it's such an important part of my practice and something I just care about. Endometriosis. We've talked about this on the GynoCast and for many years when we were on live radio. But endometriosis is a condition that is not rare. It affects 10% of reproductive age girls and women. And it causes, to varying degrees, painful periods, painful bowel movements, painful urination, painful intercourse. And for many women, it can be almost disabling. Mm-hmm. And oftentimes one of the things we do to manage this can be surgery, but oftentimes we can manage these conditions with birth control pills or hormonal contraceptives in one way or the other, and give them a quality of life that they would not have if they didn't have access to them. And so I'm going to go back to just gender equity and fairness, is that these things have to be available to women. and adolescents. It's just not fair. It goes beyond contraception. It goes towards allowing a portion of our population to be able to live effective, happy, comfortable lives and interact with society in a way that's good for everybody.
I agree with that wholeheartedly.
And again, polycystic ovarian syndrome, which we've done a show on, is a condition that we think affects up to 10% of women, just like endometriosis. And it starts in adolescence oftentimes. It can cause abnormal periods. It can cause acne. And over time can cause infertility. And can put women at increased risk of heart disease and uterine cancer. And one of the easiest and most effective ways we can intervene is to put kids, adolescents on birth control pills. It works wonderfully for most of these young people. And you can intervene if you're paying attention to it and you have access to this mode of treatment. You can change the trajectory of a young person's life.
Absolutely.
I love the visual of that. And you can see the same thing with endometriosis, same with so many things, that if you can recognize things early, you can change the way they will go. You could go in one direction or another direction. And these conditions that I'm talking about managing with birth control pills and other hormonal methods can impact women and girls in a way that can really impact their ability to lead fulfilling lives.
Well, they can be really debilitating.
Exactly.
Like a lot of the symptoms that come out of the conditions you talked about, they can be extremely debilitating. You don't have quality of life. You can't really engage with life the way that you would like to because you're in pain and it's constant pain.
That's right. And so what I want to encourage people to do is to think about this and to talk to your legislators, and at least, no matter where you are on the spectrum of how you feel about contraception and offering contraception, to be able to advocate for the women in your life, the adolescents in your life, for example, to at least have access if they have some of these other conditions that can be impactful in their lives.
Well, I feel like it's important that we at least point out in a part of this discussion sort of the way that the system stands right now. If you're a parent and you have a teenager or a younger daughter or sister or someone that is in your life that may need this type of medication for this purpose, it's just really important that you're clear on what your stance is, and make sure you make that clear to your doctor, and make sure you make that clear with your child. That's a conversation you should have. If my daughter needed birth control, or if either of my daughters needed it for pain management, I would happily make sure that they had that, because we've already had conversations as a family of what our expectations are for our children. Children want to know what you expect of them. They want to know what the boundary is. Yeah. So if the boundary is we're at the doctor's office and you're suffering and you're in pain, I'm not going to forego giving you birth control because I'm afraid you're going to go out and have sex now. Why? Because you and I have already had this conversation. We've had a family conversation. We've had multiple conversations from mother to daughter saying, this is what I want you to do to respect your body. This is the expectation that your father and I have for you. This is the expectation we have in terms of you becoming or getting involved in any kind of sexual contact. We don't think you're ready for whatever reason. Have the full conversation, because then you know what the boundary is. Then your kid knows what the boundary is. Then your kid knows what you expect of them. And you've already taught them a certain level of respect for their body, a certain level of respect for themselves, and understanding what consent means, and understanding of what sex means,
right,
in terms of if you're going to engage in something like that, so that if they go to the doctor for a completely separate issue, that it doesn't have to turn into this fraught, like, we haven't talked about sex conversation. Right. You've had these discussions. You have an understanding. You can even make it clear with your child, with the doctor, that we're being clear about this. This is for this particular thing.
So what you're saying is it's terribly important for you as parents, we as parents, mm-hmm. to have the conversation about the lingam and the yoni.
There you go again.
So here's the segue.
Okay.
So this is like in the tantric.
That was great.
Yeah. You like that? How I wrapped it up in a little bit.
That was great.
So in the tantric, stuff that we've talked about, like the Congress of when you engage in sexual Congress.
Well, wait, you have to explain that. So tantra and tantric are terms
like
that are
Kama
applied
Sutra,
to,
the
right. There are apparently types of study that leads to sort of deeper, more meaningful sex, because there are changes of position and breathing and things like that all sort of come into play.
Yeah. and that's for another show. But I just
Yep.
I just love that they call it engaging in sexual congress. Can't you
Yeah,
and so there's the Congress of the blank, Congress of the cow, Congress
Okay,
of the
I
stork.
knew we were not going to get through a first season without you saying Congress of the Cow at least once. I tried so hard.
Well, look it
Yeah.
up. But anyway, so you got the lingam, which
Right.
is the male part, and you got the yoni.
Okay, so the lingam, is the penis and the yoni is the vagina.
Yes.
So I was right about the yoni because
were-
that's what they
the
call
yoni balls.
Yeah,
or
they,
the
they're
yoni
called
whatever.
yoni eggs or
Yoni
whatever. And they're
eggs.
like, remember we had a whole
Yeah,
Gwyneth Paltrow
Don't
rant
put an egg
because
in your yoni.
yeah, well they were made out of jade and you're supposed to put them in there. And I mean this is a big thing. People use the women use them. They're on sale everywhere right now. But that's
Well, I think if you clean, probably okay. That's another conversation. Let's not get off track.
yeah,
here.
let's not do that. Another show.
But the thing that cracked me up even more, and I don't know if this is even true or not, so I'm not gonna. But this is what one of the things I read was. You know what lingam translates to?
No, what?
You ready for this?
Okay.
I'm not gonna tell you.
Oh, you already said. Heaven.
Wand of life.
Oh, please. You need to tell me that. Of
Is
course,
that good or
of
what?
course, some man back in the day decided to name his wiener the Wand of Life.
The wand of life.
Same people that probably decided to say that we have wandering wombs.
That's right, probably.
Heavens to Betsy.
So if you want to continue the conversation about the lingam and the yoni and the wand of life,
Yeah.
perhaps you need to get on the GynoCast Facebook group.
Yes, you should. It's very easy. Go to
So easy.
Facebook and look up the GynoCast. You can request to be a member. The membership is not sort of open. It is a closed group, specifically because we talk about sensitive issues, sensitive topics, and we want it to be a supportive place where we can have difficult conversations in a safe and supportive environment.
That's right.
And sometimes when you have a name like the GynoCast, Yahoos show up
people
and
crawl out
think
of the
they're going to be
holes
funny
and-
and interesting over there, and that's not going to happen in our group.
That's right.
We definitely want you to participate and be a part of the group, so make sure you go to Facebook and join us.
All right, thank you for listening to the GynoCast, and we will see you soon.